Hi, I'm Dr. Meg Julian from the Emergency Services of Oradell Animal Hospital. I'm here to talk to you about how to recognize and help a pet who has suffered a cardiopulmonary arrest at home. It is most important to stay safe and calm. It is critical to not be bitten by a painful and disoriented pet. If your pet has been in an accident, it's also very important to try and minimize handling, and as this may worsen injuries. The first step is to recognize that a problem has occurred. Cardiopulmonary arrest is the cessation of breathing and heart beating. So the first thing you should do is try and assess your pet's responsiveness. If your pet has arrested, they won't be conscious for more than a few moments. So call their name and watch their breathing and gently pet them to try and see if they'll respond. You can also check for a blink reflex, where you just gently touch the inside of the eye to see if the pet will blink. All of these things should be absent if your pet has arrested. It is important to make sure your pet is not just sleeping or lethargic before initiating CPR. It is helpful to watch your pet's breathing while they're healthy and doing fine, so that you feel comfortable knowing what normal chest wall movements are, as opposed to shallow respirations or excessive effort of breathing in a problem situation. If your pet is not breathing, and if he will allow, carefully pull his tongue out of his mouth and look in the back of the throat. You can move any saliva, foreign material, or mucus forward and out of the throat, out of the mouth with your finger. Be aware that there is the hyoid apparatus, or the Adam's apple. This is a normal bony structure in the back of the throat, so you don't want to attempt to dislodge this. If you see foreign material stuck further back in the throat, or you're sure your pet is choking, then you can perform the Heimlich Maneuver. So you want to carefully lift your pet so that his back is against your body with his head upright. You want to hug him with your fist in your other hand just below the rib cage. You're going to want to give 5 sharp thrusts upward into the abdomen. Inspect the airway and remove any foreign material that you see at this point. The Heimlich maneuver often results in abdominal trauma or chest wall trauma, so you want to truly be sure that your pet is choking or obstructed and not just coughing. If you're in doubt and your pet is conscious, then you want to just go to a veterinary hospital to have him assessed. If there are no obvious obstructions, then we can give some breaths to get some oxygen into the lungs and to ensure that the airway is open. So you want to lay your pet gently on his right side, like this Skippy, and you'll want to have his head and neck straight on the ground and extended. You want to move your head down to his nose and not turn his head up to you. So you want to be doing this. And you want to fill your lungs with air and then exhale into his nose. So you're going to reach around him and exhale into his nose. Just like you want to release the pressure and allow the chest wall to relax, and then give another breath. Each breath should last 1 to 2 seconds and should be fairly gentle. It shouldn't take very much air to inflate the lungs of a small dog or cat. If there is great resistance and you're not able to make the chest wall move, then there may be an airway obstruction, and you may want to go back and consider doing that Heimlich maneuver, especially if your pet is unconscious. If the breaths were successful, then we can move on to focus on circulation. If there is a second person available, that person can continue to give 1 breath every 5 seconds, or about 12 breaths a minute, if your pet has not started breathing on their own. To assess circulation, you can feel the chest wall for the heartbeat and feel the leg for the pulse. The heart can usually be felt best where the elbow meets the chest wall, so right about in this area. And you can just feel the heart beating there. The femoral pulse can be felt by starting at the knee, move your hand inward, and then up the thigh. And you'll feel on the inside of the leg that you can feel a pulse there. Both of these things will be absent if your pet has arrested. You should practice feeling these things in your pet while they're healthy, just to be familiar with the landmarks. If his heart is not beating, you should begin chest compressions. Continuous chest compressions are the most important aspect of CPR and should be continued without any interruptions for breathing or anything else. if only one person is available to do CPR. You should kneel behind your pet's back and apply even pressure to the chest with your palms. For really large dogs, which Skippy's not so large here, but for really large dogs, you're going to want to place your hands parallel over each other, and you're going to want to press onto the largest part of the chest. For smaller dogs like Skippy, you're going to want to move closer to where the heart is, so right where the elbow meets the chest wall. And then for small dogs, like less than 15 pounds, lay down, Skippy. Or for cats, you're going to want to use one hand with your fingers on one side of the chest and your thumb on the other. In these cases, it's very important that you press with your whole hand and not just your fingertips like that. So it's correct to use your whole hand. In any of these cases, you want to compress the chest by about 30% and allow full recoil, equal time for full recoil after every compression. You want to aim for 3 compressions every 2 seconds, or about 90 beats per minute. Hopefully, CPR will be effective, and your pet will begin breathing, and the heart will start beating on its own, and your pet will regain consciousness. If this is the case, you still want to proceed to a veterinary hospital in order to have your pet assessed, and so that we can treat the underlying cause of the arrest situation, but also so that we can help to deal with some of the problems that can occur from lack of circulation or lack of oxygenation. Unfortunately, CPR is often not effective, even in a hospital type setting, let alone at home. So if your pet has not responded in any way after 20 minutes, further CPR is probably not going to be effective. So at that point, you should probably seek veterinary care to make sure that the situation is as dire as you thought it was, and to see if any other treatment options exist. Any questions that you have about performing CPR can be addressed by your veterinarian, and although we all would, it's a good idea for us to be prepared to do CPR, it's much better to address problems before that situation occurs. So you should see your veterinarian anytime that you think there is a problem or see any symptoms. Thanks so much.